So how does this help us? How does culture help us think about HIV prevention? There are several ways that cultural theories and analyses can help make public health's production of knowledge more efficacious for HIV/AIDS prevention, research, policy, and practice. I want to focus on 2 points. One that I find that in sort of common everyday ideology, and I find in a lot of research that comes out of public health, there is a conflation between race and culture. Particularly when it comes to Black and Latino people. Race is primarily an imposed category, and culture is primarily something that we do and make. Race tends to be fixed. Culture is more open and mutable. So I think that we need to take into account some of the discussions today about how that conflation of race and culture refracts the ability to account for the diversity within race and ethnic groups, but also how it helps us understand the way cultures are created within communities, right? So, for example, the ballroom community exists it's embedded in Black communities. It draws from cultural practices that are African diasporic. It also exists within and is embedded in larger Black LGBT communities, right? It draws from those practices, and it creates its own space from within that marginalization, because ballroom is not necessarily appreciated by the larger Black LGBTQ community or treated correctly, nor is it a community that is respected in the larger Black community. So it creates a different cultural space, right, within the community in which it's embedded. So we can't conflate race with culture in that case. Culture is something that is more generative, something that can happen within a particular race and ethnic group, okay? So I've written elsewhere that that conflating and confusing race with culture is a failure to account for the diversity within race/ethnic groups. But it's also a failure to consider the ways that alternative cultural formations occur within race and ethnic groups. And these alternative cultural formations serve the needs of those communities where they are not getting those needs met in the larger community context in which they are situated. Now, this is important when we think about intervention. If we conflate race with culture, then we're not creating interventions that are culturally specific to that particular community formation within race and ethnic groups, right? To assume that to create a intervention that's just for Black MSM, that you are going to account for the diversity among Black MSM is part of the problem, because we assume that all Black MSM are the same, that power relations are equal, and that everyone is engaged in the communities in the same way, and they occupy the same space. Members of the ballroom community that are Black and Latino LGBTQ, increasingly young, poor or working class, right? They've created a different way of thinking about their sexuality and their gender identities and their notion of family that is not the same as the experiences of other Black MSM, for example, right? So sometimes we find that interventions are imposed, and the research is often too disciplinary, lacking in interdisciplinary, and too hierarchical. Prevention strategies are often based on the constructed category of high-risk groups, which we've spoken to earlier. The implementation lacks sociocultural competency. And there's a wide gap, and this is really important, and I want to talk more about this. There's a wide gap between the intervention research and the on-the-ground practices engaged by the very people the intervention is supposed to serve. In other words, much of the research comes late after people have already been doing these things. People have already constructed, created, and developed resiliency and protective factors before the intervention actually comes to the community to help to foster those resiliency factors and those protective factors. Now, part of that I know is bureaucratic and funding and so on and so forth. Okay. So what do I mean by a new, I want to rethink the epistemology of HIV/AIDS and think about a new logics of HIV/AIDS prevention. So Judy Auerbach also says that a new area of research on structural interventions have emerged in recent years to promote responses that target community and societal change rather than individual behavioral change. Now, this has been spoken to quite eloquently by the speakers who came before me, that you can't consistently think that an intervention that is focused exclusively or even predominantly on individual behavior change will work for a collective community, right? And that has also been one of our problems. And so I just want to note that in this kind of new thinking, this new logics, we also need to think about the language that we use. In my research, I use more agentive and transformative language, such as practices, as opposed to behavior, right? I draw a distinction between behavior because I think behavior is more of an imposed category. It doesn't capture the ways in which people do things, right? The ways in which people do things by making certain kinds of decisions and creating certain kinds of protective strategies and resiliency strategies in order to deal with the crisis that we face. So, as I talk about in the article, the new logics of HIV/AIDS prevention, this intravention, is something that I read from a study that Samuel Friedman et al. Did. And he refers to communities of intravention. And he suggests that communities of intravention captures what so-called communities of risk do based on their own knowledge and ingenuity to contest, to reduce, and to withstand HIV in their communities. Because he argues that the individual behavioral change model is limited. Cognitive behavioral theories that focus on the individual may not provide sufficient understanding for such efforts because they lack the concepts and methodologies needed to identify, understand, or intervene in structures and processes that are at the cultural system community network levels. And this is where ballroom enters. Now, as I said before, ballroom is a Black and Latino LGBTQ community. Most of my ethnographic research I conducted in Detroit. Because ballroom is a national, or I would say North American network, because there's a ballroom community in every major city in the United States. There's a ballroom community in Toronto, Canada, a very active one, right? It's a national network. Most of my work was conducted in Detroit. I'm a performance ethnographer, so I'm a part of the actual research that I conduct. Performance is my methodology. It's also my theoretical framework, right? It's my form of data collection. I was a member of the House of Prestige. I competed in balls, and I worked for an HIV/AIDS organization in Detroit that had a ballroom program. And I also participated, I snatched a trophy in the HIV prevention ball that is held here every year called Love is the Message. Okay. So I also conducted research because it's a network and houses have chapters, right? So it's like, I think of it as a kind of family reunion. We have overall balls where we all get together, members of the various chapters throughout the country. We all get together and have sort of like a family reunion ball, right? And so I did ethnographic work in Los Angeles because we had a prestige chapter here, and also in the Bay Area where I attended university. Okay, now, ballroom has its own gender system. So here's another example of how cultural practices, cultural formations can emerge from or created within larger communities. All right? The gender system in ballroom is not like, I mean, there are some shared concepts, but it's not like what we understand gender identity and sexuality identity and sex identity to be. Ballroom conceives of three sexes: woman, a person born with female sex characteristics; man, a person born with male sex characteristics; and intersex, a person born with both male and female or various configurations or of indeterminate sex genitalia. There's a six-part gender system, 6 identities. Butch queens are biologically born male who identify as gay or bisexual men. They are and can be masculine, hypermasculine, or feminine. Femme queens are transgender women, or M to F, at various stages of gender reassignment, i.e. hormonal and or surgical processes. Butch queens up in pumps, Butch queens up in drag. Butch queens up in pumps is my book. Butch queens up in drags. In the ballroom community, butch queens up in drags, they draw a distinction between those who live as women and those who perform and compete as women, right?